Good afternoon, and welcome once again to number 6 Convent Place, to our daily information conference. This afternoon, I'm joined by Dr. Daniel Casaglia, who will be providing us with some of the detail of the Nightingale Facility and the new laboratory set up at the university. Both of these facilities are going to be a very important part of our forward-looking posture as we transition to living with COVID-19 in the background. Today, I will concentrate my time before Dr. Casaglia addresses us on the GHA and on ERS. I want to start, though, by giving you today's updated statistics. We've now carried out almost 5,000 tests for COVID-19. The actual number is 4,941. We've received 4,689 results already. The number of confirmed cases of COVID-19 remains 147, and the number of active cases is therefore still only 3. I will never tire of saying that we have had no deaths to date. Our Nightingale facility remains a COVID patient virgin, and our COVID ICU and our COVID John ward at St. Bernard's remain empty of COVID patients. Of all of the things on which I have led as Chief Minister, that record, as we come towards the beginning of Phase 2 of our plan to de-escalate and unlock the rock, is undoubtedly the one of which I am proudest. Today, I went to see the people who made this a reality. I visited the GHA, where the posture is moving towards the unlocking that we have proposed. As a result, I've been able to express my gratitude and the gratitude of the whole government, and indeed of the whole community, to the people on the medical front line. I visited the primary care centre. They are really now in a great environment in that new facility that has really come into its own. This new facility has enabled us to put in place social distancing and to put in place different mechanisms for our GPs to see patients. And our GPs and primary care staff have stepped up in a remarkable way. I want to thank each and every one of them, not least Dr. Elaine Bincher, who eloquently talked me through how they are doing some phone consultations with members of our whole community, not just the elderly. I think we're now providing an incredibly modern and efficient service that our GPs, all our primary care staff, and our citizens deserve, and that we should further invest in going forward. We have to ensure that we cement the advances that our medical professionals in primary care have delivered. They will have our support in doing so. And I must say I was very proud and pleased indeed to see this new facility in operation. I want to thank Rose Suisse, a veteran of all our primary care centres since they started in the early 1970s, for her guidance in the establishment of that new facility, and Susan Clomedo for the work that she has done in bringing this new facility into operation. I also want to especially thank Dr. Valerie Flores for her attention this morning as she outlined to me what the new protocols were for the operation of the facility. I sincerely felt that the numbers they were dealing with showed how remarkable the service that they have provided has been. Listen to this. In the time since we declared the beginning of the COVID pandemic, the primary care centre have dealt with 24,155 patient contacts, with that figure including the 111 call line and those who called to inform them of, or rather they called to inform of negative results. They've dealt with 12,000 nursing contacts, mostly face-to-face, but also telephone consultations. I was very pleased to be able to pop in to see the district nurses today who've also done such an extraordinary job in this time. Sincere thanks to all of them. Our primary care centre have dealt with 15,000 repeat prescriptions through telephone and email consultations also in that period. For a community of our size, those are literally wow numbers. I then saw the incredible work being done in the St. Bernard's laboratory. There we went from having no capability to test for COVID to being self-contained in our ability to test, even before the new lab up at the university established this week. Alex Menes, Audrey Olivares-Smith and Natalie Hernandez showed me the extent of the work that they have done, and I saw how their teams have been augmented by public sector workers who are now helping out in the lab. The level of equipment that we've acquired and the expertise of our staff there is clearly top of the league. All of the tests that we're doing to be able, or we're going to be able to do, relate to the companies that have supplied our equipment, which is therefore compatible with the testing we will be doing for antibodies also. I very much look forward to going back to the lab to hear more about the incredible work that they're doing there, and not just on COVID-related issues, but on all of the afflictions and ailments that we test for in our community. You should all know, as I found out today, that our lab is quality tested against 80,000 UK NHS laboratories, and I'm told it is always in the top tier of assessments. Again, we have invested greatly in the service provided by the lab, and that means that we've spent a lot of money there since 2012, but it is money very well spent and invested in the great people who we rely on for this service. I then visited the COVID ICU, the COVID John ward, as well as A&E. What an incredible set of people I met there. The doctors, nurses, orderlies and cleaners who are putting themselves in the way of this infection in order to save the rest of us from it. I was incapable of expressing our gratitude to them eloquently enough. At John Ward, I saw Dr. Gareth Ladine and his dedicated team of professionals and matron Jolene Gonzalez. At ICU, I was shown round by Arancha Velez and ICU clinical nurse manager Giselle Dosso. I do not think it is possible for me to explain to you how brave these professionals are and how unassuming they are in the context of what they have done to date and what they may be called upon to do in future. They are people of jaw-dropping humility and ability in equal measure. Finally, I went to see the work being done by the great people who are manning the new 111 service. I want to also thank Dr. Elaine Flores, Elaine Ferro, and Sigurd Haviland. That is really an incredible new backbone to our health service, a new method of triaging every single call that comes into the GHA, even the majority of the 190 calls. That really has been a step change in how we interface with those needing care. I must tell you that those I saw this morning have been stepping up, and their diligence and their work has delivered the lack of casualties to this disease. They will have the ear of the government for their proposals to improve and further integrate their systems into the provision of healthcare going forward. They will be the new filter to the service, and they will have me, in my capacity as the Minister for Public Finance for this nation, defending the investment that they deserve and need. Just as I have every penny of investment since 2012, and I will continue to do. I was not able to visit ERS today, where we also have many unsung heroes, but I do hope to be able to visit them soon. I was not able to visit for the same reason that many of you are not able to visit your relatives there yet, because it is not yet safe to do so. But Antonio Marin and Susan Vallejo and her team will be working to put protocols in place to enable you to do so as soon as it is safe. We constantly review this. I've been in touch with the leader of the opposition on exactly this issue also. And if possible, we will find some mechanism to provide some degree of visitation access as soon as we safely can. We will continue to work to try and provide that safe mechanism. Yesterday, I was, however, able to visit one of the key factors allowing us to start the process of unlocking, and that is the new lab facility up at Europa. In less than a week, Daniel Casaglia and Wayne Gris, together with so many other colleagues, no doubt, have been able to get this facility running. I think what they have done is really quite unprecedented. Our thanks to the university also for its unstinting support, but in particular to these two gentlemen and their teams. And thanks also to Dr. Batty and his team at Public Health Gibraltar. Danny will now be able to tell you a little more about the new lab and the processes it will follow. Being up at Europa also means it is literally a stone's throw from the Nightingale Facility, which Danny also was the lead clinician for. He will also tell us a little about how we will wind down Nightingale and keep it ready to go should the virus return with any virulence. Before I hand over to him, I should add that I have not been able to mention everyone I saw today or mention everyone who deserves praise in the GHA for the work done. Evelyn Salvan, Krish Rawal and Paul Valvan have also done so much. So many have too. The cleanliness has been key. The maintenance, the facilities management, everyone has stepped up. So, to all 1,159 employees of the Gibraltar Health Authority and the locums on top of that, thank you. Thank you sincerely on behalf of the people of Gibraltar. Thank you from the heart of the rock. And this is not just talk. When all this is over, I will put our money where my mouth is. And I will ensure that we always continue to have the investment and resources that we need going forward to continue to enjoy the health services that we need and deserve. And now over to Dr. Casaglia, who has also bravely stepped up when we needed him.
Thank you very much, Chief Minister, and good afternoon to you all. The last 2 months have been extraordinary. Our daily lives have been affected in a way that was unimaginable just a few months ago. And throughout this lockdown, it's become apparent to us all that team effort is what has driven Gibraltar to succeed in suppressing the spread of the virus. And in my role as paediatric doctor, we've worked as a team at the aptly named Rainbow Ward. And we've all seen pictures of rainbows drawn by the children of Gibraltar to spread hope and cheer during the pandemic, and sending the message that somewhere over the rainbow there are happier days ahead. Soon, hopefully. Thankfully, we've had very few paediatric admissions to hospital during the lockdown, and we know that the virus tends not to affect children as much as adults. And the paediatric team are keeping track of new information about this virus emerging on a regular basis. Some of you may have heard of the new, in the news over the last few days, about a newly recognised but rare condition affecting children triggered by COVID, similar to a condition called Kawasaki disease. And I just want to reassure all of you that we're experienced in dealing with Kawasaki disease, and we're ready and able to manage this in the unlikely event that we should have a patient come through our hospital doors with this rare condition. There's also the maternity ward team, where business continues in the new normal way that we all refer to now. And maternity, I think, is a happy example of how the GHA can still continue during a pandemic to provide the most essential services in order for life to literally continue. And I'm happy to report that we've been able to welcome to Gibraltar a whole new generation of what I've already heard some families refer to as their lockdown babies. And in the period from the start of the lockdown to date, we've welcomed in the region of 50 new babies to Team Gibraltar. So the ongoing vaccination service conducted by the wonderful team at the Children's Centre is yet another example of an essential service that has continued within the new normal. And if anything, this pandemic has reminded us of how important immunisations are in the protection of our population against dangerous infectious diseases. And it's imperative at this juncture that I remind all families that you can play your part by ensuring that your children are fully immunised. I've also had the pleasure of working with the GHA electromedical team recently, led so efficiently and enthusiastically by Kevin Eagle. While still working within the normal team setup, they've had to adapt very quickly to new scenarios, and nothing has been too much or too difficult for them. Within a short period of time, we were able to commission a new oxygen plant at St Bernard's Hospital and set up a liquid oxygen plant at the Nightingale Hospital. As we know from reports from the UK Prime Minister Boris Johnson, through his COVID-19 illness, patients admitted to hospital with COVID usually require litres and litres of oxygen while they're unwell. And you may have read in the press about hospitals running out of oxygen. Here in Gibraltar, the government ensured that no patient would suffer for lack of oxygen. The GHA electromedical team have also played an integral part in reconfiguring the university laboratory into a new public health laboratory. And I'll talk a little bit more about that later on. Team spirit as well was essential at the Europa Point Nightingale ward. From the military expertise of Stuart Bensadon, whose team built the facility, to the GHA nursing team headed by Sandy Gracia and led by Natasha Serisola, Sarah Smith, Priscilla Ryan and Natalie Dignam. And they turned the facility into a hospital. And the clinical team combined together with a whole new workforce which was drawn across the whole of the public service and other agencies and authorities to manage this new facility, this new hospital. We now know that our healthcare system will be able to cope with a resurgence of cases that may arise after relaxing lockdown measures, and hopefully we won't need to, but we're ready in case we do. We were also assisted by a team of volunteers, including Freddie Beto, formerly from the GHA, and many others who volunteered to help out in so many different capacities. The Nightingale facility, thankfully, has not been used for patients and will slowly be decommissioned in tandem with the release of the lockdown. At the moment, the Nightingale facility can be activated at very short notice, and within 24, 48 hours we can be up and running again. But as the lockdown proceeds, if we're confident that we're not going to need the Nightingale facility, we can mothball it little by little. We will always have the equipment and the facility available. We're going to be storing it, and we can bring it up at some point in future should there ever be a need to have a hospital, a field hospital like we've had now. The Nightingale staff, however, have been redeployed to form part of the Contact Tracing Bureau. So the staff that were there ready to take patients if needs be have now been redeployed and have retrained to be part of the contact tracing team in conjunction with the team at St Bernard's that's been formed as an extension of the 111 team. And this has been another example of great team spirit. Going forwards, we need to unlock the rock as safely as possible and in a way that minimises the risk of a resurgence of the virus in our community. And as we start to unlock, there will be more movement of people and more opportunity for the virus to spread in our community. And in order to control this, we're implementing the strategy to test, trace and isolate. And as you will already have heard in the previous press conferences, the aim is to find as many cases of COVID as possible in our community. And right now we know there are very few cases around. And then isolate those who have the virus and their close contacts. The aim being to interrupt onward transmission of the virus to other people. Excuse me, sorry. We will continue to test all those who have symptoms of COVID, but we will also aim to test up to 300 people per day. That's 1% of the population per day to look for the presence of the virus in people without symptoms. And we will test those groups that are more likely to be exposed to the virus, such as frontline workers and those who are more likely to transmit the infection to vulnerable groups. The Public Health Department and Civil Contingencies commissioned the Public Health Laboratory at the University of Gibraltar. And this is the laboratory that will carry out the targeted testing of those without symptoms. They'll be using a new procedure, a new test called the LAMP test, which has been commissioned by and developed by Dr. Nick Cortes in the UK. So the laboratory will process up to 300 tests every day, and the results will be available on the same day. I just wanted to add that we couldn't have got the laboratory up and running in a week if it hadn't been for the great teamwork and collaboration of Gibraltar University, Civil Contingencies, Public Health and the GHA, who all worked to make this project a success. Wayne Agris of the GHA laboratory, who provided essential expertise and advice and liaison with the St Bernard's laboratory team. Aaron Asquez and his team from the GHA IT department, who mobilised and installed the IT systems that will track the samples through the laboratory and upload results onto the GHA systems. And then our scientists, Dr. Zoe Vincent and Edward Cruz, who will now be working very closely with Dr. Nick Cortes and his team at the Hampshire Hospitals NHS Trust. Validation testing, I can report, has already started yesterday and continues today and over the weekend. And as soon as that's complete, we'll know we're getting accurate results. Testing of the first swab samples will start thereafter. Over the next few days and weeks, the team at the Public Health Laboratory will scale up the numbers of tests carried out per day and work it up to 300 in the first instance. So I just want to talk a little bit about the Contact Tracing Bureau. So once the team at the laboratory produce the result, what happens next? Well, people who test positive will be called by the Contact Tracing Bureau, and they'll be informed of the result, given health advice and interviewed. They'll have a case interview. And as part of that interview process, they will be asked to identify anyone who has had close contact with them during the time that they were considered to be infectious. The positive cases will then need to self-isolate for a period of 10 days. The contact tracing team will then trace those contacts reported by the person who tested positive and they will be called up, informed that they've been in contact with somebody who has developed COVID symptoms or is positive for COVID, and they'll be asked to immediately self-isolate for 10 days. And it's really important to note that this 10-day quarantine period prevents any potential onward transmission of the virus. Now, thankfully, if you're called as a contact, most contacts will not develop COVID. However, it's important that if you are a contact and you develop symptoms during the quarantine period, you should call 111 for further advice. The Tracing Bureau, Contact Tracing Bureau, will call and contact people regularly to make sure that they're okay during the quarantine period. Right, so to ensure that the well-being of the community, it's vital that people follow all the guidance from the Contact Tracing Bureau. This test, track and isolate system that we've put together will be the eyes and ears of the public health team and will allow close monitoring of how the virus is spreading in our community. Given that information, knowing what's happening in the community, public health will be able to intervene at an early stage if the virus starts to spread out of control. And by isolating those of you who test positive and all your contacts while you were infectious, we stop the onward transmission of the virus. And again, I can't say this often enough. If you get a call from the Contact Tracing Bureau, please follow their advice. It's by isolating a small proportion of our community that we allow the majority to get on with their daily lives for the benefit of us all and allow us to unlock our economy. I just have to emphasize here that we still continue with the social distancing rules and washing our hands regularly. And in this way, we can all contribute to restricting the onward transmission of the virus. So your cooperation is crucial. This plan will only succeed if we work together to stop COVID from spreading. And now it's time to pass the baton over to you in this next phase of the lockdown or the release of the lockdown to help us unlock safely. Remember that the threat is still out there, but Team Gibraltar has demonstrated that it's possible to contain the spread. And it's essential that we work together to ensure containment of the virus in order to be able to enjoy our civil liberties. Thank you to all.
Thank you very much indeed. Now we're joined by some members of the press in the press room this afternoon, and Christine from GBC. Do you want to kick off?
Yes, to Dr. Casaglia. Nightingale was set up at leisure, we can say, with foresight. So, God forbid you should need it again. You're going to need it in a situation where the GHA will be under pressure. That's why you'll need it. So how much easier do you think it will be to rebuild once it's been mothballed?
I don't think it's accurate to say that it was built at leisure. I think
didn't feel like leisure from where we were sitting.
It'll be even worse if you need it again.
Well, it's not going to be unbuilt. It's going to be there.
Yeah. I think leading up to the 1st of April, there was a lot of pressure to deliver a working, functioning hospital in a completely alien environment of a sports hall. I think we were able to do that on the 1st of April, but I think the team were very, very clear that we had to upgrade the facilities over the next few days and weeks. So we would have been able to cope with a surge of patients if we'd had them, but we've been able to upgrade at leisure, and I think that's correct. But luckily, it's been at leisure because of the success of our lockdown measures. Going forwards, this facility will be able to be packed up and set up at short notice. All the cabling and all the wires and all the equipment has been labelled and will be packed away to be brought out at some point in future. We've even spoken about running an exercise on a regular basis where we bring out the hospital and set it up. The estimate is it will take 5 days to 7 days to set up, and given the experience, I think that's quite achievable.
Dr. Casaglia, a very quick one before I move on. In terms of the contact tracing, we've had a situation, somebody called GBC to tell us that 2 people have a test done on the same day. One of them is positive, one of them is negative. Yet the person who's tested negative also has to self-isolate because of the contact tracing.
Yes, well, so you mean two people who've been in contact, one of whom tests positive, one of whom tests negative. Okay, so the answer is yes, because the test itself is a PCR test. What it does is it detects minute amounts of virus in the nose and throat. Now, if you have the virus and I'm exposed to you and I contract the virus, it can take up to 7 to 14 days before the virus appears in my nose and throat. That's what we call the incubation period. So just because a contact trace negative tests negative on the day that they were in contact with somebody who's positive doesn't mean that they're not going to develop the virus. And this is because of this incubation period that's between 7 and 14 days.
From the Chronicle, you've spoken about the level of investment that has been made in response to the COVID emergency in terms of new equipment, facilities such as a new laboratory, but are you yet able to put a figure to that type of investment?
Not yet. I mean, I can, for example, tell you that we know the cost of different pieces of kit, but I can't tell you the whole cost of the investment. And I think this is where the point needs to be made, that a lot of what has enabled us to deliver against the COVID emergency did not come into effect as a result of the COVID emergency. So the new primary care centre was delivered late last year. The new sports facility up at Europa would not have been available to be turned into a Nightingale facility if we hadn't invested in that sports facility. So you've got to also think about what the cost of those beds are rather than the cost of the sports facility, what the cost of some of the works that we're doing at the PCC now are, and to take that out and say that's the cost of the pandemic. But I think it's important that we see these things also in the round, and the things that we are able to do as a result of the Gibraltar that we have today, and how we were able to upscale that Gibraltar a little bit further in order to deal with the pandemic. And I think those are therefore two different sums to keep in mind. The original investment that we've been making, in our case, since we were elected in 2012 in respect of other parties before then, and then the exact investment that we've been making since the pandemic was declared and we started to spend against it. John.
And Dr. Casaglia, I just wanted to ask you a question in terms of the Nightingale facility. Yes. To what extent would you say that the Nightingale facility would be able to handle the sort of large-scale pandemic that could have been seen in Gibraltar in this context? I mean, what have been the challenges so far, and what could be the challenges in the future, considering that this second wave, as it's been labelled, could arise in the near future, perhaps this summer or in September?
Yeah. I think we need to remember that our primary healthcare facility is St Bernard's Hospital, and part of the preparations that the GHA made was to uplift the number of beds that they had at St Bernard's. So they increased capacity, they increased the number of critical care unit beds, the number of ventilators, etc. So in a resurgence of cases, if we have a massive increase in cases, St Bernard's will be the primary place where people will be looked after. If St Bernard's starts to fill up very quickly, the less acute patients would be transferred to the Nightingale facility. And we were perfectly well equipped to be able to deal with patients of low acuity who need oxygen. So we've got plenty of oxygen there to give patients with COVID, because that's the main treatment. And we could have easily managed the 238 beds we had at the moment and increase further to 300 if we had to. And I think it's important to note that needing all those beds at the Nightingale was the worst case scenario that we could have had. And I think we were ready for that. And you always have to prepare for the worst. And we would have been able to cope if that had happened. Thankfully, though, a different story has been told.
So you don't think in that context that it was an overreaction to create
Not at all.
This facility, or was it actually a possible scenario?
Not at all. I think you need to plan for the worst and hope for the best. It's like an insurance policy. You don't take out an insurance policy hoping that you'll end up having to use it, but it gives you peace of mind, and I think that's important for us to have had that facility was our insurance policy, just in case this got out of control.
I think I said during one of my early addresses that nothing could make me happier as we came out of this process for somebody to accuse us of having overreacted. So nothing could have made me happier going into the weekend than to hear that question termed in that way. Perhaps a question from one of our colleagues who isn't here.
A question sent in from YGTV for the Chief Minister. Some over 70s living in pensioner estates are confused about what the future holds after the 21st of May, when regulations affecting the freedom of movement of all citizens are repealed. Will security guards still log their movements when they leave these blocks? And will family members be able to visit them if they keep their social distance?
So I think it's important that we understand that what's happening at the entrance to those blocks is not happening as a result of the regulations that we published. The regulations affect the ability of individuals to move freely, but the security guards who are at the entrance to those blocks are not there as security guards to in any way seek to restrict the movement of individuals. The law does that, and our law enforcement agencies would provide for enforcement of that law if necessary. The security guards there are actually positioned there for another purpose. They're positioned there to stop people who are not tenants from accessing the blocks and to assist tenants who are tenants of the block to receive material that may be brought for them by people who are their relatives or friends and want to have things delivered to them. And the registration of names is going to continue because it's important that as part of our contact tracing, as part of the work that we're doing, we have as much of a record as possible, in particular in those areas which we have responsibility for as landlord, which are clusters of those who are over 70. But after the 21st, assuming that Cabinet on Monday sees numbers which confirm that we can pass into phase 2, as we sincerely hope and expect that we will be able to, we will repeal those regulations. There will be no restriction of freedom of movement, but as landlord, we will continue to operate those particular premises in that way. And our advice will not change, however. For the over 70-year-olds, our advice posture remains exactly the same. Stay home. You are safer at home. That is now going to be advisory rather than compulsory as from the 21st of this month, we hope, assuming we get through this weekend with the same sorts of numbers being reported and the Cabinet can then approve and move into phase 2.
GBC, Dr. Casaglia again. Talking about the testing at the university lab, I understand that there are several processes, and one of them offers a quick turnaround, the other one perhaps more accuracy. What will you be looking at? What do you think is more important?
Well, the testing that's being carried out now is called the direct lamp, which requires no pre-processing of the swabs. It goes, after preparation, it goes straight into the machine. That test is not quite as accurate as the diagnostic quality test.
That's the one you'll be opting for.
That's correct. But remember, this is a screening test, and when public health and the microbiology team have looked at the test and the test performance, the agreement is that it's absolutely sufficient to be able to find these asymptomatic cases in the community. And that's the test that will be used at the moment. Going forward, there is the opportunity to turn that test into a more accurate one by doing a prior RNA extraction, but we don't have the capability to do that yet. The importance and the reason for doing this test is that it's fast, it's quick, you can get lots done in a day, and it's accurate enough for the purpose of screening.
Chief Minister, sorry, very quickly, to follow up on what Christina from the Chronicle said about finances, the COVID-19 fund, will you be making available what that money has been used for?
Of course, that's what the fund is going to provide for. The fund's rules will be published. We've agreed the fund's rules with the opposition, and the fund has already been established, and the fund rules will either have been published today or are in the process of being published, and that will enable the whole community to have detailed oversight of what the spending has been and the cost to the community more widely has been in respect of COVID, with a very detailed breakdown of what it is that we're saying the money has gone to or where the money has failed to come in as a result, so that we understand what the cost of this pandemic has been, and it won't be over for some time. We'll continue to see impaired revenue streams, we'll continue to see augmented expenditure for a considerable period of time, and that's even if it all goes away now.
Chief Minister, what is your sense of what the prospects are for a return of contact sports and spectator sports? when might we see a return to sort of sporting calendar that we're used to? And what are the best and worst case scenarios in that sense?
So I think the detailed work that's been done by the GSLA and is set out in the table in the Unlock the Rock document tries to give each sport a sense of when they might come back. I understand that that work has been done with the sporting associations. Some have concerns that if things are going well, they might have an opportunity of coming back sooner. I'm be very pleased to see sports come back sooner in particular areas where we may have thought that we need to be more prudent. And as we move through the stages, and if the numbers continue to be as low as we want them to be through the phases, and we don't see them come back as a result of any strand of what we may have done, it may be possible for Public Health Gibraltar to advise the GSLA to agree to the requests from some of the sports to proceed sooner towards normality than we might have expected. But look, it's impossible for me to pretend to you that I know enough about each sport, that I know enough about public health, or that I would be able to give you anything other than my gut reaction, which is to say that I hope we'll be able to get there as soon as possible in respect of every sport, but that every sport is different and the advice will be different in respect of every sport. Olive Press.
Okay, Dr. Casaglia, just a question here about the antibody test.
Mm-hmm.
Just a report came out today which suggested that 93% of the cases of coronavirus in Sevilla were like not asymptomatic. That's quite high, I suppose, no? In Gibraltar, the evidence points to around 2%, correct? If I'm correct?
2.5%, yeah.
Asymptomatic, yeah?
Asymptomatic, yeah, so no symptoms. So this
Okay. So in terms of, in those respects, do you expect that perhaps the cases of antibodies within an antibodies test will be a lot higher than the 147 so far confirmed to have had the virus? And if so, can you give me a reasonable estimate of how many do you think could have been have the antibodies and therefore be supposedly immune, if that is actually a reasonable suggestion at this point?
I'll bring out my crystal ball.
Sorry.
It's very difficult to speculate on this. I think there are many people out there who said, oh, I was very sick in December and January, I think I've had it, and are hoping that they've had it so that they won't have it again. I think the antibody test will allow us to look back and see how many people have had COVID without necessarily knowing they had it, and what percentage of the population will have some kind of immunity to it. And again, it's difficult to know what the test actually means in terms of how long that immunity will last for, etc. So there's a lot of information still to come before we can answer those questions effectively. I think if we knew the answer to your question, we wouldn't bother doing the test.
No, of course, but I mean, I just wanted to know, because I mean, there have been people who have probably wrongly assumed that they caught it in December. I mean, is this unreasonable?
There will be people who were missed, definitely, but because we haven't seen that surge that other countries have seen, we haven't seen those patients in intensive care and those patients struggling to breathe in hospital. I actually think that we don't have that many undiscovered cases in our community. That's my own personal feeling, but we'll see once the antibody test is rolled out. We'll have a better idea of the prevalence of COVID in the community and how many people have had it today.
Can you just confirm when those will start?
I know for a fact that there are plans afoot, but no firm date has been set so far. Public Health and GHA are in discussion about the optimal time to launch these tests.
Could this be at the start of September, or at the end of, or during summer?
Again, I can't give you a date. There are advantages and disadvantages to delaying the testing, but that's down to Public Health and GHA to decide.
Okay, thank you. Any questions from those who are not here?
Final question from YGTV for Dr. Casaglia. Many grandparents are understandably desperate to see their grandchildren. Given your paediatric expertise, what is the current guidance regarding how likely it is that some children are asymptomatic carriers who could spread the virus to vulnerable relatives?
So again, I think children are just as likely as adults to be asymptomatic carriers, and we have to follow the social distancing rules again. Repeat that. Just follow the advice that we're putting out about social distancing and meeting up with relatives. We have to protect our most vulnerable, and we're not yet in a position to unlock things enough to allow that to happen yet. But please watch out for public health advice.
Okay, thank you all very much indeed. As you know, next week on Monday, the Cabinet will be considering the returns over the weekend of the numbers of people infected with COVID in our community, and will then be able to determine whether it is safe for us to move to phase 2 3 weeks after we moved into phase 1. That pause will enable us to determine the safety and the prudence of taking that approach. Finally, I should just say that I know that the issue of ERS is vexing many of you who have relatives in the residential facilities that we have for the elderly. Just as a salutary reminder of where other nations are, the United Kingdom is reporting today 12,000 deaths in elderly residential care facilities in the United Kingdom, as against just over 32,000 deaths when I last saw the figure. So we are being very careful here for a very, very good reason. We are not for one moment trying to keep you away from your relatives for a second longer than we have to. And believe me, I've had a relative in institutional care in ERS. They are extraordinarily well looked after. It's that care which is taking us to be particularly careful in the way that we grant access to those most vulnerable in our community, those who we care for the most. So thank you for understanding that although this is emotionally painful, we want to ensure that we create no physical risk and inadvertent physical risk, because I know none of you would turn up at ERS if you knew you had COVID. You would stay away, but this disease does not always manifest itself, and therefore you may be an asymptomatic carrier, and the love that you bring may also be laced with the infection of COVID, and that is the unfortunate reality of what we are dealing with. Finally, Danny said that he'd seen the welcome of a number of lockdown babies already. Well, I'm sure that there will be an influx of lockdown babies and new Gibraltarians in December, January and February of next year. Thank you very much for being with us today. I'll be back on Monday hosting this press conference again. Thank you.